Hi, my name is Valerie Gouon-Evans. I'm from Boston University. And today I would like to thank the organizer for giving me this great opportunity to share with you our work on the use of mRNA encapsulated in lipid nanoparticles to alleviate the liver disease in mice. The liver is known for its fascinating ability to regenerate. However, during severe acute or chronic liver injury, this ability is compromised. So MyLab develops strategies to harness liver regeneration by promoting the naturally occurring repair mechanism. So those include the hepatocyte-driven liver repair, in which hepatocytes, the main functional cells of the liver, proliferate to compensate for the loss of the liver tissue. And there is also the cholangiocyte-driven liver repair that occurs when hepatocyte proliferation is exhausted. In this condition, some cholangiocytes are believed to be a source of liver progenitor cells, and as such, they proliferate and they differentiate into hepatocyte. Cell therapy using primary human hepatocyte or patient-specific induced pluripotent stem cell-derived hepatocyte is also a strategy that we're investigating in the lab. So to harness this mechanism, we propose to use the key hepatocyte mitogen HGF, hepatocyte growth factor, and EGF, epidermal growth factor, as well as growth hormone and VEGFA. And to do so, we needed a tool to deliver this regenerative factor into the liver that would allow robust yet transient expression to prevent any deleterious effect. So we chose to use nucleoside-modified mRNA. So those are in vitro transcribed messenger RNA, and they harbor modification pioneered by last year Nobel Prize winners Katalin Karikó and Drew Weissman. And this modification prevents immunogenicity and increase mRNA stability and translation into proteins. So they have many advantages. They are clinically safe, as they do not integrate into the genome. They have been, in fact, successfully used by Moderna and Pfizer BioNTech to produce the COVID-19 vaccine recently. And when mRNA are complex with lipid nanoparticles, they specifically target the liver. So they allow control expression of protein with time, and their expression lasts a week at most, which is a key advantage when we induce mitogen expression. So first, we injected mice with luciferase mRNA-LNP to confirm the liver specificity of expression of mRNA expression. And we showed also that the expression lasted about 3 days. And to identify the cells now that are transfected in the liver, we injected a green fluorescence protein mRNA-LNP in mice. And we found basically that virtually all hepatocytes, the main functional cells of the liver, were transfected, as well as 70% of endothelial cells and 40% of the Kupffer cells and the macrophage of the liver, while the cholangiocytes were not transfected. So as a first therapeutic intervention, we demonstrated that the co-injection of the two key hepatocyte regenerative factor, AGF and EGF, mRNA-LNP, rescue a chronic liver injury mouse model. So in this model, mice were fed the choline-deficient ethionine supplemented CDE diet for 3 weeks to induce steatohepatitis, so the fatty liver and inflammation, as well as hepatocyte death. So mice were then treated twice with a AGF and AGF mRNA-LNP during the recovery period. So we show that the mitogen rapidly the mitogen rapidly restores the serum ALT level to baseline level just 2 days after the first injection. And the treatment also sharply eliminates steatosis, which was still seen here in red in control RNA-treated mice, and where we can still see macrosteatosis. So consistent with this data, the level of cholesterol found in the serum of mice were inversely proportional to the degree of steatosis seen in the liver. So altogether, this data demonstrates the clinical benefit of AGF and EGF mRNA-LNP to sharply eliminate necrosis and steatosis, two features of the chronic liver disease. So now I would like to tell you about the project of Anna Smith, a PhD student in my lab. This project aims to harness cell therapy for liver disease. And here she transplants primary human hepatocyte or human-induced pluripotent stem cell-derived hepatocyte to treat the liver disease associated with alpha-1 antitrypsin deficiency. And for that, she used the immunocompromised PiZ mice that mimics the human liver disease. So in the liver of these mice, hepatocyte produce misfolded mutated Z-AAT protein that can't be properly secreted in the serum, but rather accumulate in the cytoplasm of hepatocyte, causing the liver disease. And this is a feature found in the AATD patient. So in order to promote cell therapy, we propose that stimulating the key regenerative pathway, AGF and EGF, in transplanted hepatocyte will improve survival, proliferation, and engraftment of human hepatocyte. So first, Anna mimic hepatocyte senescence seen in the liver of this patient by injecting mice with 1 dose of AAV-P21 that induces expression of the cell cycle inhibitor P21 in hepatocyte. Then she transplanted 1 million of primary human hepatocyte and injected twice a week for 2 weeks mRNA-LNP encoding AGF and EGF in these mice. So Anna collected liver from mice treated with either P21, AGF and EGF, or the combination of both. So she stains this liver with human hepatocyte marker, human albumin in red, or human nuclear marker, Q80 in pink, and proliferation marker, EDU, in green. So she found that in the presence of P21, AGF and EGF treatment indicated with the dark blue columns improves the survival, the proliferation, and the engraftment of transplanted primary human hepatocyte by quantifying the number of cell clusters, the number of cell per clusters, the number of EDU positive cells per cluster, and the percentage of human albumin positive area in the liver section. Oops, sorry. So impressively, now injection of AGF and EGF mRNA-LNP for 5 weeks leads to robust and sustained engraftment of functional human hepatocyte, as shown here, with a steady increase of human serum albumin over time, reaching even up to the milligram per ml range. And at that time, up to 30% of the liver was repopulated with the human cells, as shown here with this pink staining showing the Q80 human nuclear staining. And importantly, the level of engraftment we obtained was sufficient to reduce the ATD liver disease burden and improve overall the liver function. So there is a significant decrease in dark purple of the Z-AAT misfolded protein load in the liver. That was significant. Also, there is a significant decrease in circulating misfolded Z-AAT in the sera of these mice. as depicted here in the dark blue column. And there is also a decrease of the liver damage with a decreased level of ALT in these mice. So overall, AGF and EGF mRNA-LNP significantly improve human hepatocyte engraftment and thus alleviate the liver disease. So this is now a strategy that we are testing to treat other liver disease. So finally, I want to tell you about the second strategy, which was the original title of my presentation. So the second strategy, it's a project from a postdoc in my lab, Fatima Rizvi. She uses VEGFA mRNA-LNP to promote cholangiocyte to hepatocyte conversion. So the rationale for using VEGFA is that it is a ligand for the receptor KDR. And we previously showed that KDR is expressed on hepatic progenitor cells using human and macaque pluripotent stem cell hepatic differentiation culture. So interestingly, in this culture, we showed that inhibition of KDR decreased the efficiency of this progenitor to differentiate into hepatic cells, suggesting to us that activation of KDR promotes hepatic differentiation. And we also identified the KDR expressing progenitor in the developing mouse liver and shows that they can give rise to hepatocyte in adult mice. So this finding led us to speculate that the regenerative liver uses the same cues as the developing liver. So Fatima specifically asked, is KDR expressed on cholangiocyte, which are known to be a source of progenitor cells following liver injury? And the second question is, can we use VEGFA to activate cholangiocyte to differentiate into hepatocyte and rescue liver function? So looking at KDR expression. So KDR is normally expressed on sinusoidal endothelial cells in the liver, but it's absent on cholangiocyte in homeostasis condition. However, in case of chronic or acute injury, we could identify a subpopulation of cholangiocyte that also express KDR, and those are indicated with an arrowhead here. So now to test her hypothesis, Fatima used both an acute injury, which was an overdose of acetaminophen, and the chronic CDE diet liver injuries that I just told you about. So mice were injected with AAV-P21 to express P21 in hepatocyte and thus mimic hepatocyte senescence observed in virtually all human liver disease. And VEGFA was delivered to the liver with mRNA-LNP. So Fatima's lineage traced the fate of cholangiocyte using an inducible Cree tomato reporter mice. So in this model, upon tamoxifen injection, cholangiocyte become tomato positive as well as a hepatocyte generated from the cholangiocyte. So here in the following slide, we're looking at tomato, so red positive hepatocyte. Those will be generated from cholangiocyte. So this is a result of the acute injury. So mice were administered acetaminophen, followed by 2 injections of VEGFA mRNA-LNP. In absence of VEGFA, very rare tomato hepatocytes were visible. This is one of them. In contrast, VEGFA, in presence of VEGFA, we see a drastic and significant induction of differentiation of cholangiocyte into hepatocyte, and about 5-fold. And here you can see this large cluster of red tomato positive hepatocyte generated from cholangiocyte. And the identity of hepatocyte was confirmed with expression of hepatocyte transcription factor HNF4 in green here. And the cell conversion was significantly occurred in all liver lobe in each mouse, and it was quantified here with a 5-fold increase in presence of VEGFA. So now this is a result of the chronic liver injury, the CDE. So here in this model, not only we see that VEGFA induce the conversion of cholangiocyte into hepatocyte with the presence of this large cluster of tomato-positive hepatocyte compared to the control-treated mice. But in addition, in these mice, VEGFA completely reverted steatosis that was still seen in the control-treated mice and also reverted fibrosis. And this was very significant. So to try to understand the mechanism of action of VEGFA, Fatima used a cholangiocyte brain bow reporter lineage tracing, allowing us to track single clone of GFP, YFP positive cholangiocyte. So that was examined in the CDE chronic liver injury, 5 days after mice were treated with a single dose of VEGFA. So we found that VEGFA drastically induced emergence of GFP, YFP positive cluster, indicated here in green, that lost the cholangiocyte marker EpCAM, indicated in pink. So supporting that they were dedifferentiating. And some of the cells within the cluster also express KDR, and these are indicated with the arrow here. And virtually all cells within the cluster are proliferating, as you can see here with the EDU incorporation in all cells within this small cluster, supporting further the role of VEGFA in dedifferentiating cholangiocyte into proliferating progenitor cells. So now for potential clinical translation of VEGFA mRNA-LNP, we look for KDR expression in cholangiocyte in advanced human cirrhotic specimen that was done in collaboration with Alex Soto Gutierrez, who provide us with all specimens. So to our surprise, we identified at the margin of the regenerative hepatocyte nodule in the fibrotic septa some cholangiocyte, KRT7 positive cholangiocyte, as you can see here in this frame number 4, that also express KDR. And we also identify intermediate hepatocyte expressing KDR that are budding from this KDR positive cholangiocyte. And also a larger cluster of hepatocytes that express KDR adjacent to this cholangiocyte expressing KDR. So we further validated KDR expression at the transcript and protein level in purified hepatocyte from 9 advanced cirrhotic specimens compared to 3 normal specimens. And this was in collaboration with Alex Soto Gutierrez, who gave us, who provided us with all the purified hepatocyte sample. So KDR transcript as well as protein level were upregulated in purified disease hepatocyte compared to normal hepatocyte. And this data suggests that VEGFA mRNA-LNP may serve as a therapy to potentialize cholangiocyte-driven regeneration in advanced human liver disease. So in conclusion, I hope I convince you that mRNA-LNP is a great tool to harness liver regeneration. Injection of mitogen, AGF and EGF mRNA-LNP induce hepatocyte-driven liver repair by transiently promoting hepatocyte proliferation and or eliminating steatosis. This is a story that I didn't have time to tell you, but it's published. I showed you that injection of VEGFA mRNA-LNP harness cholangiocyte-driven liver repair by rescuing the hepatocyte cell mass, but also eliminating steatosis and fibrosis. And finally, I showed you that injection of AGF and EGF mRNA-LNP promote primary human hepatocyte engraftment. So I would like to acknowledge my whole lab, who established as a team the mRNA-LNP platform to promote liver repair. And especially I would like to acknowledge Fatima Izvi and Anna Smith, who did the work I presented today more specifically. And I would like to thank our collaborators, Drew Weissman, Norbert Pardy, and Ying Tam, who provided us with all mRNA-LNP that we use in the studies, and also our collaborator, Don Gunshin and Alex Soto-Gutierrez, who are collaborators on Fatima's project. And I thank my funding sources, and thank you for your attention.